Good evening. It is Monday, March 10th, 2025. I'd like to welcome everyone to our Board of Health meeting. It is 6:03 p.m. and we will call this meeting to order with a roll call. Stephanie Granger here, Michelle,
Here.
Megan,
Here.
Joanne, here. She's
Here.
Okay,
Sorry.
great. Stefan.
Here.
Great. We have everyone present this evening. And our first agenda item would be open forum. Do we have any?
We do not have anyone asking any questions. No,
Okay.
no one for open forum.
Then I guess our next agenda item would be to review the minutes from February 10th. I did not see anything that needed changes. Did anybody else notice anything?
Didn't see anything.
Nor did
Megan?
I.
Was it intended to be fluorination instead of fluoridation?
Oh, good catch. I do not think so. I missed that. Can you, let's see.
Sorry, there was a couple times. There was once in the first paragraph and then
Okay.
and once at the end.
There it is. February.
Yeah, I'm not sure if they're both appropriate or if
Yeah,
fluoridation
I don't
is
know.
better.
Yeah, I just noticed it. And
I'm Googling.
Shouldn't it be fluoridation, not
Fluoridation.
fluorination?
That's what we were thinking.
It should be fluorid with a D because it's fluoride.
Fluoridation. Yeah.
Yeah.
Interesting. So it says fluorination is the addition of a neutral fluorine atom to a molecule. Fluoridation is the addition of a negatively charged fluoride ion. So probably fluoridation. Water is fluoridated.
What did I say?
So yes, let's have those be changed. So then, is there anything else that anybody noticed? Would anyone like to make a motion to accept that with just well, I can make a motion to accept the minutes with the change of fluorination to fluoridation. Is there a second?
I'll second.
Michelle seconds. All in favor. Stephanie Granger, aye. Megan?
Aye.
Stefan?
Aye.
Michelle?
Aye.
Joanne?
Aye.
Thank you. You guys just move around on my screen periodically. I just go in the order that I see you. Okay, then we have the next agenda item, which is the draft of the Health Department strategic plan. That looked pretty great, Ray.
Excellent. Yeah, so as part of our community health assessment and improvement plan, we are required, the third piece is the strategic plan of how exactly you're going to implement your programs and your priorities out of the health assessment. So our consultant did bring in focus groups, interviews, as well as the health department met over 7 initial meetings to discuss what we wanted to prioritize out of the priorities that came out of the community health assessment. So this is the draft product. This is put together by our consultant for accreditation. And so as a requirement, we're to bring that to the board, get any input or feedback that you might have. And then if you could vote on the draft or let us know if you'd like anything changed, we can certainly address that.
Okay, it said in it that it was going to be presented to us on April 14th. Are you just presenting it earlier?
We're just presenting it earlier to give you a chance. If you would like more time to review it, we could certainly understand that as well. There are interviews taking place also with several stakeholders. For instance, some examples, the town manager's office, other departments, DEI, Commission of Disability. They're all being interviewed to see how the health department interacts with them, partners with them, ways that we can make it improvements and things that we're doing well. So we're waiting for that input. That we'll receive that at the end of March. And
Will
so
that go
that
into the
piece we can
strategic
certainly
plan?
show you in April.
Okay. Michelle?
No, no comments. Everything
Okay.
looked good. I was
Did any-
telling my husband to start dinner.
I hope
Does
he's
anyone else have any comments or questions about the strategic plan? So I mean, I read through it. I didn't read through with a super thorough eye. I don't know, do people feel like we're ready to vote to accept that draft or?
So were there going to be changes made by the people, Ray, that you said were looking at it? Like, can we, like, if we vote on it now, is it going to be modified and we have to re-vote on it after it?
No, so this will be the final draft for the strategic plan, and then the piece that is interviews will be a separate package that will be, if you will, an addendum or an appendix to this draft plan.
And then we would vote on that at that time after we review it?
Correct. Yes. Yep, we can wait if you want to wait. We're not in a hurry for the vote. It's just something that where this first piece is done, they asked us to bring it to our board.
Okay. My only thing would be to say that it said it was coming in April and it's here in March. So that might need to be changed, but
Okay. We'll make sure the date's changed.
um, anybody want to make a motion on that then?
I can
Okay, I'll
make
do
a
it.
motion.
Oh, go ahead.
I can make a motion to approve the Westford Health Department Strategic Plan version 6 as is.
Second.
Okay, motion made and seconded. All in favor, Stephanie, I, Megan,
Aye.
Stefan,
Aye.
Michelle,
Aye.
and Joanne.
Aye.
Great, thank you. That,
Thank
yeah, I was
you.
impressed with it, Ray. I thought it had some really good things in it.
I think it'll be a great document to help us in the future with our department goals,
Mhm.
and we'll try to plan those goals around the strategic plan. So that'll be great.
Yeah. Okay, then our next agenda item is the resource guide for first responders.
So the fire department approached me. They were really looking for a tool for the field, for a tool to be able to hand out to residents, families. Right now, we have a booklet for domestic violence that our police and fire department hand out to both the perpetrator and the victim. We have different resources for different things, hoarding, the clutter image, things like that, as you're all aware. This is more when the fire department goes out and they have a client that needs some services, whether they're looking for mental health services or I'm trying to think of some of the recent issues that have come up. But what they're finding is they're having to go on their phone and kind of look for all of these services. You know, they might have a resident that needs fuel assistance or needs the lockout program with the fire department. So they asked for a resource to be put together, a little booklet that has tabs, that's very easy, layman's terms, very simple, not pages full of lots of text. And so they wanted to make this happen immediately. So we put together a meeting with all of the stakeholders and players here in the community, included veterans, police, fire, and it was really, I would say, very productive. We really had the players at the table, if you will, our social workers, police and fire, of issues they're seeing in the community, police, and how can we all work together to get those resources together? As you all know, not everyone has access to the internet or is able to use the computers and that thing to try to navigate through our websites for the resource guides that we already have on our social media pages, websites. So I think this is going to be a great product. We do have funding to have this printed, and we're working really hard to put all of our information together. There's really been some great success, and when we have that product ready to go, we'll certainly show it to the board. Our hope is not only to have police and fire hand these out in the fields, but to be able to put them out in the library and areas around the community if someone's to need it. The other piece is, I don't know if you've heard of the File of Life. And so that's a little pouch. It says File of Life on it. It has a magnet. And in the pouch is a card where it would have all of your demographic information, medications, medical history. And that's something it's a card that goes in the folder. You can attach it to your fridge. It also comes in a little tiny one that you can put in a wallet size, so that if it's something for yourself, maybe a family member, doesn't matter the age, that information is readily available. God forbid 911 or first responders had to respond to your home or to your situation. So we're hoping to put the booklet with the File of Life and put that in some kind of an envelope that will hold both with a magnet, and also have it freely, but to have the pouch so that you could have both together in your home. And that's something, again, we're working on. So I just wanted to bring that to your attention. It sounds like it's very much needed here in the community.
That sounds great. I worked on something like that for another town earlier. Do we have personnel to do it, or is something an intern could be doing?
Actually, Nicole Lavaliette, who is our town community health and wellness coordinator, has set up SharePoint. We've all put in our information. She's getting quotes, and then we'll go back and meet with them all again to see how they like the look of it.
Okay, great.
When you say folder, are you talking about like standard paper size kind of thing that fits an unfolded piece of paper? Or are you talking about like a little coin purse size thing?
Yeah, I know it's hard on the screen, but so I would say it's 2 by 3. It's a little booklet that we hand out right now for domestic violence. It's a thick little booklet. This would be about a quarter of the booklet. But it would be a little tiny booklet that they would hand out with just phone numbers. We wouldn't put person's names. It would just be positions.
Okay.
Have you been involved with, like, was the senior center part of the discussion?
They are. Yep.
'Cause I think
Yep.
it would be
So
probably-
all of Health and Human Services departments are at the table. And again, it would be a two-part. It would be all the information and phone numbers that you need, but it would also be some of the basic programs. Like we have the special needs registry here at the health department for folks that want to sign up if they have someone in their home that might have a disability or a need, for instance, in a power outage. We have that registry that's updated annually. This would also be something, the lockbox program, some of the programs that would really be very beneficial to the residents that they may not know that those exist. Most people know fuel assistance exists. I say most, but things like the lockbox program or assistance with, your firing CO2, if you're a senior citizen here in the community, might not know that those services are available.
Yeah. Oh, that's great. Excellent. Any other questions on that? Okay, then we are on to our next agenda item, which is food recalls added to the health department website.
So Abby has been working really hard, and feel free to pipe up, Abby. So food recalls, if you're not aware, through the FDA, they come in every single day, not just for food. You could sign up, any resident or anyone for that matter can sign up for recalls. I mean, every day, whether it's makeup or child products, food, it's every day. So we do get questions. Some are more national, some are more local. And so Abby put together this food and drug recall system, which is on our main page of our website if you scroll all the way down, and it's in real time, so it updates itself, which I absolutely love. And so she did a great job with that, and if I botched that, Abby, please let me know. But that is something we do have, not only businesses here in town. Before, we used to have to email them every day to say, hey, this probably pertains to you. It's a dog food recall, it's a peanut butter recall. So this is nice.
It's listed as, sorry, I'm looking.
That's okay. So it's on the Town of Westford Health Department webpage.
Yep.
And when you scroll all the way down, It says food and drug recalls.
As a quick link or?
And it pulls directly from the FDA, correct, Abby?
Yes, yep.
I'm not seeing it. Where am I not seeing?
Are you going to the main website and then
I
selecting?
think you're going too far.
Health Department?
Above the quick links.
Then selecting what?
Just go on,
Yeah, Health Department. So
yeah,
I'm on your
government,
page.
yeah, department's Health Department. It should be there. Just open the main Health Department page, it should
Yeah.
say.
Is it on the left or
Where
is it
you
the
were on
center
quick
section?
links, it's
It's-
above that. So it's above the red bottom thing and the blue banner. Like it's in, like I think you're scrolling up higher than where you were. I had to scroll up to get to it.
Sorry, just want to be able to understand where it is.
See it?
No, it's in the center section or in the,
On the shared screen, I think someone put it up. It was
Oh,
just there a
okay.
second ago.
Can you see it on the shared screen?
We could. Now someone's clicked on some other tab. They're on Facebook.
Oh, all right. Let's see.
It
That's our town
was,
Facebook.
it was literally there like just before the Facebook.
Sorry, I have multiple screens going
Oh.
here. Bear with me.
the Health
There
Department
it is.
Facebook page?
Here we go.
Okay, so here's the health department page.
Yeah.
And if you scroll on down, I know it's hard, there's so much information. But this is the
Oh.
food and drug recall.
I
So
don't
you-
know why I wasn't seeing that. Okay.
That's
I
okay.
think
So
it's right there, but I just didn't see it.
nope, no worries.
That's
There
cool
it
that it's real
No,
time.
I don't see that. That's really, oh, there it is. Got it. Okay. Yes, right there. The last thing in the center section.
So if you're
Um,
having your morning
the department.
coffee and you're bored, you can just peruse that.
See if your screen
Check
is
out everything that's
expired.
What to eat and what not to eat
Yeah.
for breakfast?
I look at it every morning. Yep.
Yeah, there you go.
Thank you, Abby. That's really great.
Thank you, Abby.
Okay, and then our next agenda item, sorry, is the National Public Health Week, April 7th through 13th. What are our plans?
So National Public Health Week, we've been working on this for a few months now. We will have a flyer that will be coming out next week. We'll put it out on social media in our general health notices with the town. But those things we're working on is hands-on CPR for families. That's really popular. It fills really fast here. So you can bring the whole family to learn hands-on. It's not a certificate program, but it's just a really more relaxed environment to work on the mannequins and learn hands-on CPR. So that's put on by our public health nurse and our MRC coordinator. Well and septic seminar, so that's very popular in the spring and fall, and that's something Abby and Sam will be putting on. That's for our realtors and our residents here, and some more to come on that date. And we have resident yoga booked. We have mental health information and working on some other activities. But each day we do try to get out, whether it's education. Right now we're working on a social media speaker for our families that are, wondering, what are the limits for social media for kids on all kinds of tablets, electronic devices, things of that nature. So yeah, we have lots of different topics that we try to cover, whether it be medical, environmental, or clinical.
Sounds great.
Yeah. So just wanted to bring that to your attention. If you ever have a topic or something you think that would be great for the community, let us know.
Thanks. Any other comments? Okay, so then we have next agenda item, town meeting, March 22nd at 9 a.m. Westford Academy.
So this is just a holding spot, a reminder of town meeting on the 22nd. In your packet, you will see the motions for town meeting. There aren't any particular that affect this particular board. However, I do like to bring this to you at every town meeting, just in case you have a position that you wanted to take on any particular article. If not, that's perfectly okay. Again, just making you aware of what the articles are on for that day.
Did anybody on the board have anything they felt they wanted to weigh in on as a board rather than as individuals? Nope, seeing none. Great, Ray. Thank you. We had our vote last week, but that doesn't appear to be or last month, but okay, so we are on to old business.
Old business, just a quick update on our PFAS private drinking water well project. Those results are coming in fast and furious, so we're putting those together for our GIS coordinators that will add those to the previous project. We have 40 participants out of 50, so we do have 10 spots open. If anyone's interested, has a private drinking water well, and would like to have their well tested for PFAS, again, 10 spots are open for that. And I did put in your packet, we have a communications consultant with the town right now. That was ARPA funded, and so any department that wants to utilize the communications consultant can. And so they've been putting together these new flyers when there's a job opening, and that's in your packet. So I wanted you to see the food inspector position has been posted, so we'll let you know how that's going. We're in the middle of interviews right now. We have 2 left for the regional community health and wellness coordinator. So just wanted to make you aware.
But you're not interviewing on the food inspector yet.
We're not. We just advertised with the new flyer that they put together. We do have to wait. You know, we had to wait a few days for them to put that together and to go through our HR department. So that has just been posted last week, at the end of last week.
Okay, I see Joanne has her hand raised.
Yeah, on that, I mean, it was very different from any job posting I've ever seen. But I did notice that it said that the food inspector reports to the Board of Health. If they report to you, you report to us.
I have let them know that.
Okay.
What happens is this new piece, if you will, before we would put, you know, any updates to the job description, we would put together an ad. And then the HR department would approve that and put that out. With this new, this new piece with the communications consultant, I did not see it ahead. So I have let them know that we'd like to make that change.
Okay. Yeah, I don't want that misunderstood. There's, there's a lot of different, positions out there with the PHE stuff and the locals and everything. So
I agree.
might turn somebody off because they don't like direct reporting to boards unless they're directors, or assistant directors, so
Nope,
you
I
don't want
agree.
to
Thank you.
lose somebody because of that.
I appreciate that. And then just the last item was the Upper Merrimack Valley MRC. So I ask her quarterly for an update of projects and items that she's working on with our MRC volunteers. We are a little over 650 right now in our unit, and so we just had an open house to kind of welcome any new existing MRC volunteers, and we had a little over 51 participate. You have your badge update. If you needed a new shirt, you wanted to chat, there were different topics. So it was really successful. And yeah, like I said, that's in your packet too if you have any questions about the MRC.
Okay, great.
I think that's it for me.
Okay. I had something I was going to ask to follow up on, but just the virtual meeting thing, right? That's
So we are waiting the empowerment bill through Governor Haley's office. We are waiting to see where that goes, and I've not heard when that'll be voted on. The town manager's office did let us know this morning that we are waiting still to hear, but as of right now, at the end of March, the virtual meetings will be or hybrid meetings will be expired. So we'll wait and see what that looks like.
okay.
As soon as I know it, I'll definitely inform you all.
Thanks, Ray.
Sure.
Well, this might be the fastest meeting we've ever had. But if there is a motion
Besides
to
the ones we've canceled.
would anybody like to make a motion to adjourn?
I can.
Thank you. And we'll just say thank you, Ray and Abby, for all the work you guys are doing, especially with short-staffed again. So
I'll second the motion to adjourn, and I'll second thanking Ray and Abby for everything.
Thank you.
Okay, so we have a motion to adjourn and a second. All in favor, Stephanie, I, Joanne,
Aye.
Stefan,
Aye.
Michelle,
Aye.
and Megan.
Aye.
Great, thanks everyone, and have a good evening.
You too. Thank you.